today. My name is Adelita Grijalva, candidate for Arizona's 7th Congressional District, and I'm proud to stand with all of you alongside Senator Mark Kelly and former Congresswoman Gabby Giffords and so many powerful voices from our community to say loud and clear, hands off Medicaid. Medicaid covers over 2 million Arizonans, including 357,900 in Arizona's 7th District. This is over a third of Arizona's children, over a half of Arizona nursing home residents, and half of Arizona's birth. But despite its importance, congressional Republicans are currently advancing a bill that cuts $716 billion from Medicaid to pay for enormous tax handouts to millionaires and billionaires. 750,000 Arizonans would lose their health insurance if the Republican bill becomes law, and put many hospitals at risk of closure, especially rural hospitals. For millions of Arizonans, children, seniors, people with disabilities, and working families, Medicaid is more than a program. It's a lifeline. It means a child with asthma can see a doctor. It means a grandparent can afford their medication. It means a parent doesn't have to choose between rent and care. Threats to Medicaid are threats to our communities. And I won't stand idly by while congressional Republicans try to slash it from everyday people. That's why we're here today, to share that our community wants Republicans hands off of Medicaid. If passed, this bill will devastate the 224 million women and 40 million children enrolled in Medicaid. Medicaid is the largest provider of maternal and reproductive health care and would rip Medicaid funds from our community health centers and care clinics like Planned Parenthood. For our kids, this assault on Medicaid would have a major negative impact. For example, over the past 5 years, Tucson Unified School District has received nearly $16 million in federal funding through Medicaid school-based claiming. To meet requirements of the Individuals with Disabilities Education Act, Medicaid covers about 20% of the district's investments to reach these important requirements. Our public schools are severely underfunded. Cutting more would be detrimental to serving our future leaders. This hits home for Arizona hospitals. According to the Arizona Hospital Association, Medicaid cuts would disproportionately impact rural hospitals, critical access hospitals, small rural facilities with fewer than 25 inpatient beds. They rely heavily on Medicaid reimbursement to stay afloat. Their communities need them. How can we force patients to travel even greater distances for urgent needs like stroke and heart attack? The bottom line is that Republicans are taking away health coverage and they are denying the most basic health care to people in order to pay for trillions of dollars in tax cuts to the wealthiest Americans. I've spent my life fighting for families, as Senator Kelly, former Representative Gabby Giffords, and everyone around me has. I did it as a school board member, a county supervisor, and a mom. I'm running for Congress to keep up that fight, and today I'm here to stand shoulder to shoulder with you all to protect Medicaid and protect dignity of every person in our state. Thank you so much for being here and for your time. I know it's a very busy time with graduations and promotions and all kinds of fun stuff, and I want to thank you all because this issue is very important. So now I am honored to introduce former Representative and my friend, Gabby Giffords.
Our lives can change so quickly. Mine did when I was shot. But I never gave up hope. I chose to make a new start, to move ahead, to not look back. I'm relearning so many things, how to walk, how to talk, and I'm fighting to make the country safer. It can be so difficult. Losses hurt. Setbacks are hard, but I tell myself, move ahead. I'm finding joy in small things, riding my bike, playing the French horn, going to the gym, laughing with friends, the small things add up. We are living challenging times. We're up for the challenge. My own recovery has taken years. Many, many, many people have helped me along the way, and I learned so much. I learned that people care for each other. and work together, progress is possible. A better world is possible. But change doesn't happen overnight, and we can't do it alone. Join me. Let's move ahead together. Thank you very much. Thank you.
Thank you so much. Thank you. Thank you for your support, Gabby. I really appreciate your leadership. Next, we are joined by our Arizona Senator, Mark Kelly.
Thank you. Thank you, Adelita.
Thank you, sir.
And Gabby is up to the challenge, more so than anybody that I know. So thank you, everybody, for being here. It's a great day, not too hot yet. And we're here to talk about affordable health care, specifically Medicaid. Now, every Arizonan, regardless of where they live, who they are, deserve access to quality, affordable health care. But Donald Trump and Republicans in Congress want to slash Medicaid to pay for tax cuts for rich people. And they finally rolled out their plan this week. I don't know how many people here had a chance to take a look at it. They've advanced this through the first step in the committee, had a little rough patch this morning. They're going to continue to work on that in the House of Representatives. And it takes a few steps to ultimately get this thing done, and it does a number of things. It's likely to freeze state provider taxes, which is really important to providers, to hospitals. It could cap direct payments. It would raise the cost sharing for hospitals and providers. And these steps, they're designed to actually sound complicated. But here is what this means in our state. Arizona's kids and seniors in nursing homes and working families are going to get kicked off of their health care. Kicked off. The latest estimate that we just got this week, I had my staff working on this to try to figure it out, but it appears that about 190,000 Arizonans will lose their health insurance. And what that means is, that means fewer appointments for kids with their pediatricians. That means fewer checkups for pregnant mothers. That means nursing home care. And by the way, about 90% of seniors who are in nursing homes are on Medicaid. That nursing home care is at jeopardy. It's also going to come with higher premiums for people who still have insurance. It's going to increase their out-of-pocket costs. For a lot of folks, even if they don't get kicked off of their health care, their costs are going to go up. And these aren't just numbers we pulled off of a spreadsheet. These are our neighbors and our friends. And these are their kids and their aging parents as well. These are victims of gun violence. You know, something very personal to me and Gabby and to this community here in Tucson. And for every person who is shot and killed in the United States, more than 2 others are shot and survive. But they often have very serious injuries that can take more than just an emergency room to overcome. And for many of these folks, Medicaid is their only option for coverage. And all of this is to give a giant tax cut for the richest people in our country, the people who do not need a big tax cut. Now, under their plan, I've seen different estimates. The one we got today, the top 1% is going to get about a $60,000 tax cut per year. The other day I saw that number at $100,000, so figure it's probably somewhere between the two. And this plan, this brilliant plan of theirs, is going to add trillions of dollars to our national debt. The promise of America is that if you work hard, do the right things for you and your family, that you can get ahead. That's the American dream. But with rising prices on everything from housing to education and groceries, that dream is getting further and further away. And this plan from Donald Trump and House and Senate Republicans is going to make that dream a much steeper climb. It's going to take health care away and food assistance away from working Arizonans who are just trying to make ends meet. It's going to leave them and possibly their kids and their parents uninsured. And that's devastating. Seniors could be kicked out of nursing homes. I've had these conversations with people in the nursing home business who do not know what they're going to do if the Medicaid funding stops for their patients. And at the top of this, the richest Americans and the wealthiest corporations, they get a pretty good deal. They get a giant tax cut. This couldn't be more backwards. Now, I'm doing everything I can to stop this, including traveling around the state to hear from Arizonans, to lift up their stories. There was a woman I met in Phoenix not too long ago, about 6 weeks ago maybe, at a town hall that we did, that Ruben Gallego and I did, where she's got a kid that she adopted out of foster care, who's on Medicaid. And when you adopt a kid from foster care, their health care is paid through Medicaid. And she said, it feels like the Republicans are burning down my house and my kids are still inside. That's how this made her feel. Now, it only takes a few Republicans in the House or the Senate who are willing to say no to stop this. So I'm calling on them to do that. Some are stepping up. We'll see how many have the courage to oppose the president's top priority, which is this giant tax giveaway to the wealthy. But we need more fighters in the House. We need fighters like Adelita. She understands what working folks in southern Arizona are going through. She's lived this her whole life. She's got tremendous experience representing this community. And she is always going to put Arizonans first as she serves in Congress. So thank you for running. And I'm saying this in advance, but thank you for winning too.
Thank you so much for your support and fighting for our community. So grateful for Senator Kelly and former Representative Giffords supporting our campaign. Next, I'd like to introduce Dr. Dan Rainieri, President and CEO of La Frontera, Inc.
Thanks, Adelita. Senator Gabby, great to see you. And Senator, thanks for everything you're doing. It's going noticed. Senator Kelly mentioned a little rough patch this morning. I think the bill didn't get out of the House Budget Committee because it wasn't bad enough.
That's true.
Yeah, it didn't do enough damage. So they have to go back and try to add to it somehow. I don't know. Anyway, I'm Dan Rainieri. I President and CEO of La Frontera. La Frontera, Arizona is the largest behavioral health provider in the state of Arizona. We're headquartered in South Tucson, but we're in Pima, Maricopa, Pinal, Cochise, Graham, and Greenlee counties. We probably serve 60, 70,000 people a year for behavioral health. We're also an affordable housing developer, but I'm not here to talk about that. I've been at La Frontera, it's my 31st year. I've been in the field since 1979. So I've been doing this a long time. This scares me more than anything we've had to deal with in my professional career. And that's significant. We're talking about pretty substantial damage, if not destruction, to the whole Medicaid expansion population, which I believe happened about 13 years ago. Just to give you an idea, I'm here to talk to you about the impacts it'll have on behavioral health, particularly where we live. So I looked at our data, and probably about 20 to 25% of our clients are eligible because of the Medicaid expansion. That's substantial. That accounts for us about $20 to $25 million a year. It's roughly 70% of all of our substance abuse services. and about 70-75% of all the services we provide to people who are homeless. If in the worst case scenario, the Medicaid expansion goes away, which is still possible, those services disappear. We're in the midst of the fentanyl crisis, maybe the deadliest substance abuse epidemic we've ever had in the history of this country. We're in the midst of maybe the worst homeless crisis we've had in the midst of this country, certainly where we live. And 70% of the services available to those folks will disappear. You can imagine what our streets and where we live will look like if that happens. And it won't be easy to fix. The funding, when I first started, a lot of the funding to provide services for these people came from other sources. Came from the county, came from probation, came from Superior Court, came from a bunch of different sources. When Medicaid expansion happened, that wasn't necessary anymore. So those sources of funding have either dried up or all been repurposed. So if the Medicaid expansion goes away, there's no funding. It's done. So just for La Frontera, I'm playing around with various models, but something that we would probably have to do, and we would have to do this probably within a 30 to 90 day period. We'd have to lay off at least 300 employees. We'd have to shut down various programs and probably sell multiple buildings. And even then, we would have a 50% chance of staying open. And we're the biggest. So you can imagine what's going to happen to everybody else. And from a behavioral health standpoint, this is a catastrophe. And when I was younger, I felt it was kind of my job to go behind all of these bad decisions and these political messes that were created and do whatever I could to clean it up. This happens this time, I'm not cleaning up a damn thing. People are going to have to wallow in what they create because there will be no fixing this. Don't let it happen. So that's my message. If you need any more details, I'd be happy to provide it later. Thanks so much.
Thank you. I think it's important for us to understand the implications for our community down to a very real level, and the fact that 300 people in our community wouldn't have a job instantly, and that all the programs that are housed in all those buildings would also disappear. Very frightening. We next have a concerned community member, Eric Ferris. Talk to you a little bit. Thank you, Eric.
Good afternoon. My question really, everyone has filled in the details very well and the severity of the situation. My question really is kind of bubbles to the top. What kind of country do we want to be? What kind of people do we want to be? My name is Eric Ferris. I'm truly a nobody. I don't ever get a chance to talk to anybody beyond my neighbor's house. So thanks for letting me talk to you today. I'm 66, I'm a former software engineer, former entrepreneur, was a Montessori elementary teacher for about 6 years. Was born and raised in Southern Illinois. I lived in Chicago for 35 years. Lived and worked in Brussels, Belgium for about 7 years. Lived and worked in Miami. So I've been around the country, been around the world a little bit. The American dream that Senator Kelly talked about was my dream when I was a little kid. About 2010, when we had this Great Recession, despite the fact that I have a couple of master's degrees and international business experience, the jobs dried up. So, to my friends who may disagree with me politically, if you're on the team this week, you might not be next week. So promoting fairness is probably a good plan ahead of time. Most of my life, especially from maybe 1988, 89, the nation has been under assault by those basically ungrateful for its successes and for their own. Very, very, very wealthy gamblers and cowboys, in my estimation, are willing to financialize everything down to the last thimble. I just don't think that's who we are as Americans. And especially for a tax break for people who don't need it, I don't think it's civilized any longer. What I've noticed through my lifetime is we have to maintain our ethos as a nation. I grew up in the greatest nation in the world. I love my country. But we have suffered and groaned together throughout history to learn to live together. We have this legacy of racism that keeps popping up, but also one of greed that keeps popping up. The late 19th century and so forth, the big historical lines, greed always seems to come back. Why do we care about Medicaid? A grown child who's waiting on employers to hire because employers are waiting for the president to stop guessing about tariffs that he seems to take very lightly. A parent who receives hospice care, my mother just passed away in the nursing home. After insurance and after the savings, it's Medicaid that pays for the comfort in her last moments. That was last year. Medicaid was there with hospice. Nobody else was. And finally, speaking as a teacher, elementary teacher, if we can't fight for a child who misses meals at home, I don't understand what we're doing anymore as a people. If we can't fight for pain control for seniors in nursing homes, I don't understand. If we can't fight for mothers who love their kids but struggle to care for them, I don't understand that. I think we're better than that. If that's the case, we've lost our dignity as a nation and we've lost our souls as individuals. And we're making America groan again by turning back the clock to the 19th century because someone has lied to us. So I hope my message is shared. Thank you very much. Good afternoon.
Thank you. Thank you, Mr. Ferris. Lastly, we have Diana Ruiz, owner of a small assisted living home in Tucson.
Good afternoon, everyone. Thank you so much for joining. Okay, how's that? Yep. Thank you very much for giving me an opportunity to speak about my situation. My name is Deanna. I'm a certified caregiver and a state licensed manager, and I've owned a small assisted living home in Tucson for over 20 years. This work is my passion. I take pride in the care that we provide every single day. But today I'm here because I'm concerned. I'm scared. These potential cuts to Medicaid and how they would affect my business, they're important, but the most important thing is the lives of the people that I care for. Many residents in assisted living rely on Arizona's All-Tex program, which is our state's Medicaid system for elderly and disabled individuals. All-Tex helps cover critical services, things like assistance with bathing, dressing, meals, medication management, and mobility. These are not luxuries, they're necessities, life necessities. Right now, there are proposals to reduce Medicaid funding. If these cuts go through, we could see lower reimbursement rates, stricter eligibility, and delayed services for these people. For a small home like mine, that means struggling to afford staffing, supplies, and the daily support that our residents need. These cuts don't just affect budgets, they affect real people, seniors, individuals with disabilities, and caregivers like myself, who take great pride in the work we do. I urge policymakers to consider the human costs of these decisions and protect the programs that help our most vulnerable to live with dignity. Unlike a large corporation, I don't have big profit margins or outside investors. I operate on a tight budget because I believe in keeping the care that we provide personal and affordable. When funding is cut, I just can't absorb the loss without it affecting the level of care that I can provide, or worse, the number of residents that I can serve. These cuts wouldn't just hurt my home, they would put more pressure on families, force more seniors into hospitals and emergency rooms, and create a crisis in a system that's already stretched very thin. So I'm asking you to think about the real impact. Medicaid isn't just a line item on a budget, it's a lifeline for so many. And without it, our most vulnerable, our parents, grandparents, our neighbors, They stand to lose the dignity and stability they deserve. Protecting Medicaid means protecting our elders and our neighbors and the people who work hard to care for them. Thank you.
Thank you, Deanna. And thank you to all the speakers and community members who've joined us today to speak on this urgent and vital issue, for lending your voices, your stories, and your strength to this fight. Thank you all for being here. Yes, give them a round of applause. We've made it clear, Medicaid saves lives, it lifts up families, and it must be protected. This isn't just a policy, it's personal. And together we're going to make sure that every person in Arizona gets the care they need and the dignity they deserve. Let's keep showing up, keep speaking out, and keep fighting, because our communities are worth it. Thank you so much for being here. I'm sure everyone is available for individual questions, because this portion is closed. We're just gonna finish up here. But everyone is available for questions, yes? All right, thank you so much. Muchas gracias, thank you for being here. Appreciate you.
You did great.